Thank you. After all those years of medical school, I just want to make sure it's doctor. So great to be here on this panel, and we're going to have a very brief but hopefully useful discussion about mental health for entrepreneurs. Um, Let me just set some context and talk about why this is important. I don't think I need to talk about why mental health is important anymore, though. I think contemporary audiences always agree that mental health is vitally important for everybody, particularly perhaps for people in high-pressure jobs like entrepreneurs. Now, how many of you would agree that mental health is important for all of us, for entrepreneurs? Yeah, pretty much everybody. Um, so let's begin by sharing some, we're going to share our perspectives, etc. So one of the things is I think we have to appreciate the fact that as human beings, we are in possession of a very strange nervous system. Statistically, we know that no other animal suffers from clinical depression or dies by suicide in the wild. We know that human beings of all animal species are the most developed technologically and intellectually, and yet we suffer like no other animal species does. It doesn't matter whether we have a good life or a not so good life, because even people who would be considered privileged and have material stuff and everything else can and do suffer from mental health issues. In fact, what we are seeing in the world, what we know is that the more developed a society becomes, and if we achieve all that we desire as entrepreneurs, then the society we live in usually becomes more mentally sick. This is true all over the world. And if as entrepreneurs and as a society and as a country, we want to maintain and retain our sanity as we scale the developmental, this journey, then we are going to have to think very deeply and start integrating certain practices in our daily life. We cannot look to the West, in my opinion, and I spent 10 years there as a practicing psychiatrist and internist. We cannot look to them for direction in mental health, clearly, because their mental health is suffering and it continues to get worse. What we can look to, though, is what science tells us today about the brain, the body, as well as what our own past tells us about mental health. And as we continue to develop and understand more about the science, we shouldn't leave behind perennial insights about the human condition. Because our brain is not new. This nervous system was created a long time before the Industrial Revolution. And this brain that gave us the power to develop also has a very peculiar nature. The nature of the human brain is that human beings do not live in objective reality. All of us right now are inhabiting our own private reality in our head. And even as we sit in the same room with the same perceptual experience, each one of us is inhabiting our own reality. And this brain of ours is unbelievable in its capacity to generate hypotheses and to act like a virtual reality machine. So as we sit here, you can generate so many possibilities into past, into future, that it can torture and does torture most people. And the biggest enemy that we have, which could be our biggest ally, is often our own minds. So meditation, mindfulness, yoga, a balanced nutrition, having a sense of humility, connection with the universe, these are perennial insights from the East that today science tells us are very, very important for mental health. And we're going to talk a little bit more about that. So Dr. Mala and Sumati, this is, I'm not a moderator, we're all talking together. So maybe Dr. Mala, you can share as a experienced clinical psychologist who has obviously seen people, for so many years. Could you share some insights about what you're seeing in practice, and what can we understand, what can the audience understand as entrepreneurs from what you're seeing?
Good afternoon, everybody. Great to be here. Thank you, Dr. Shyam. Again, mental health and entrepreneurship. Today, we are amidst a lot of you are, budding entrepreneurs, startups, founders. According to me, Shyam, what I would look at from the mental health perspective, the relationship between mental health and entrepreneurship is quite paradoxical. On the one hand, it offers extreme rewards. On the other hand, there will be extreme stress. So it provides conditions for both well-being and ill-being. right? So well-being is where, yeah, we can get that success, autonomy, freedom, sense of meaningfulness. And when we do not know how to cater to that needs, how to manage our boundaries, how to dwell within ourselves in the right space, that also the risk factors is very high. That is, obviously, all of you know as entrepreneurs, hard work, the timing, like there's no time boundaries. You have to work 24/7, right? I mean, financial stress around, again, the families. Obviously, they will ask for your time. You'll have no time. So all this will result in a lot of stress-induced conditions. If you're not catering to that well-being aspects of self, this can lead to burnout and stress conditions. So typically when I see from my perspective, Shyam, what I see when clients walk in, and I see a lot of clients who are coming with work-related stress, job-related stress, who would have started on their own ventures. Typically when they come into the clinic, come into my clinic and want to, they would have come with elevated symptoms of anxiety and stress conditions. Like elevated symptoms, it could be like lack of sleep, not able to sleep, excessive worrying, ruminations, not able to focus, and physical symptoms like palpitations, racing heartbeat, tightening of chest, and they would have actually gone to a lot of specialists before even coming into the clinic. They would have gone with this physical symptom saying that, is it my heart condition? Am I going to go have a heart attack? And then after all the evaluation and test, a lot of the specialists would have directed them towards us. No, it is stress related. It's psychogenic, not organic or physical cause. So here, when people come to a clinic, when they visit us, they come to the mental health specialist, what we tend to look at from the manifested symptoms, we call it as, is some predominant underlying factors. And I think in one of the previous panels, I saw some of the panelists here talking about fear of failure. Here, when we try to understand the underlying predominant factors, one of the most observations that we do is that fear of failure and fear of uncertainty. And again, when we try to understand where is it coming from, all of us have fear. I mean, any startup for that matter, anything we get into, fear is a very normal emotion. Why shouldn't we fear? We have fear. But when fear works as a motivator, it is something that helps us to grow. But many of the times, it becomes a psychological barrier. It kind of paralyzes decision making. And that is when people start spiraling into mental health conditions. So when we try to help people and try to look at where they need help, we try to go deeper into their identity and into their selves. Like, what is their self? What do they hold there? And that identity is not just who I am, what it encompasses through all their growing up years. There is also a genetic aspect to it, but it is defined through all their growing up years, developmental stages, their values, beliefs, experiences, memories, culture, social surroundings. So it has a lot of aspects to it. And this is where we try to help them understand what are they doing in their life, what are they searching for. And this is broadly the framework I'm trying to see from my perspective. I think this is something that I see very, very visibly, that when people come to therapy, we would want them to understand the concept of self and who they are, like what they are, rather than what should I do to alleviate the symptoms.
Thank you, that's really interesting. And Sumati, what are your thoughts about what Dr. Mala has shared in terms of the kind of stress that she's seeing in practice? Now, you've been with the United Nations and you're currently with the Sri Sri Center, where I understand you're doing research in aspects of treatment from India, which are relevant for health, including yoga, meditation, etc. Can you share a bit with with us about your journey and what insights you have had along the way?
Sure. Thank you, Dr. Shah, and thank you, Dr. Mala. So let's go with the UN perspective first, and let me see how many of you agree. UN says and actually it's kind of these standards they've set for what is mental health, right? On one hand, it's depression, schizophrenia, mental illnesses that require medical intervention. And on the other hand is everyday stress, where they have solutions like take a deep breath, go out for a walk, smell the roses. I think, my experience, there is something in between, and I would like to change it from mental health to mental fitness. I don't know if you all agree with this, right? It's about productivity, performance, focus, being available for your children at the end of a long day, and all of the things that was mentioned about entrepreneurs. With risk-taking, an entrepreneur loves taking risk, but with that comes fear, it comes adrenaline highs and lows. So these are things that I think every entrepreneur needs to manage. The mind matters. So let me tell you, we did a study, 30 entrepreneurs. We took 60 actually, 30 we did the study on, 30 were controls. And they went through a period of 90 days of stress management techniques with 20 minutes of investment each day. Everybody beforehand had the same problems. Fear of finding funding, not fear of failure, not knowing when their next mentor is going to come from, not knowing which direction to go. All of you are familiar with it already, and all 60 had the same issues to begin with. But at the end of 90 days, the 30 who had practiced these lifestyle and mind management techniques scored higher on resilience, ability to face conflict, ability to take decisions faster, their response time was faster, 40% improvement in sleep, 36% cortisol went down, which is an interesting stress marker. Huge number of changes. I can share this study with you all. Just to say that what's within matters. And as I said, it's about mental well-being, mental fitness is something I think we all need to think about.
Thank you. That's very true. In fact, I think it's perhaps not even, it's about mental fitness, it's about resilience, it's also about transformation, which is a lot of times when people go through crises and difficult times, that's the time that they make changes that prove to be transformative in a very positive way. And we see that all the time. I also want to just go back to what you said, Dr. Mala, which is about identity, which is so true that the entrepreneur often is quite lonely in their journey. They are dealing with a lot of stress, obviously. They're really attached to certain outcomes, many of which are outside their control. And so there's isolation, fear, anxiety, and when things don't go well, as you said, it feels like a blow to the self. And that's what, when I was talking about earlier about the unique human problem, is that is where our suffering lies. It lies in the complexity of our identity and the things that we require to maintain an integrity of that identity. And because the mind can think of various ways in which the sense of self will be attacked, it becomes quite scary. Do you think that in general you're seeing people handling it differently? There's a lot of information about mental health. Not all the information may be good, but there's a lot of information. There's definitely a lot of conversation which is good. What have you seen in your practice? How has popular discourse about mental health, has it affected behaviors or insights or anything like that? Or do you feel it hasn't changed the environment?
I think
it's a question for all of us, yeah.
I think from what I have been seeing from my practice and observation, Dr. Shyam, this awareness and insight about mental health and well-being has been working really well in this past decade. I mean, I've seen a lot of youngsters, especially young adults, 20s, around 30s, they are well aware. They know what they're going through. They would have ChatGPT, Googled, and come with a lot of their list. I'm going through this. They're aware, which means there is less stigma and inhibition that we see as of now. And people are open to talk about their issues to a professional, which would not have been case like decades back, where there is this openness and awareness which is helpful. And we as specialists or mental health, in the space of mental health, we see that people do know what they're going through, but our whole objective is to help them, make them aware around their blind spots. All of us have blind spots. All of us carry our unknown zones. We come with a lot of things where we come with our rational awareness. We know, or they come with saying, you know what, I'm depressed. I'm feeling anxious. They come with that. Why are you feeling sad? What is that depression? What does it mean? What does anxiety mean? So this is very specific to each individual. As you have been also touching upon that, I think each person has a unique definition of what it means to the self. And we need to explore that self with individuals from their perspective of what they understood and give them an opening to themselves better.
So it's good. There's less stigma. People are more open, and they do come to you. And as you said, therapy, a lot of times it's knowing what you don't know, because we don't know what we don't know, and often insight lies in that area as they become aware. I think the issue also with mental health is that it's one of those unique specialties where you have professionals who are from different backgrounds working together. And for optimal health, you need physical health, brain health, mind health, and relational health. So, all of those aspects are important. Sometimes people can have chronic stress that can lead to depression and anxiety. Sometimes people can have biological reasons, and they can be situations where there's no overt stress, and yet a person can go through depression. In fact, the misconception sometimes is that people often ask a person going through depression, but why are you depressed? You should not have any reason to be depressed because your life seems amazing. And that is something that we should understand, that the perceived quality of one's life may be great, and yet conditions can be such that a person can go through clinical depression. In many ways, when we call something depression, there are many types of depression. There are certain depressions that are more psychologically grounded. There are certain depressions that are more biological. And so it's really important to know that your mood, our decision, our entire life that way rests on the health of the mind, and therefore also on the health of the brain. And they're all related and important. And this strange dichotomy in psychiatry between the psychological aspects and the biological aspects, and the further fragmentation between the mental aspect and the physical aspect, is unfortunate, and it is a result of the kind of the science that we use, which is in some ways it has to deconstruct and go into smaller and smaller areas. At the same time, any practicing therapist, psychiatrist knows that there's a certain holism that we require. In every person, we understand the condition. We also look at context and try to see what we can shift. So the fundamental pillars of health, whether it's physical or mental, and in fact now, of late, I think a lot of billionaires are finally aging, so they're losing their collective minds over mortality, and so you'll hear a lot of conversation and talk about how to extend life, how not to be old, and how not to die. Anyway, with all that millions of dollars, hundreds of millions of dollars spent, the science still says what we knew always are the only validated methods of anti-aging, which is sleep well, eat healthy, balanced food, exercise, have good, nourishing, truly loving relationships, and have some kind of meaning and purpose in your life. And what we know is that these are the fundamental pillars of mental and physical health. Something we all know. I'm sure everyone in this room has heard this time and again, to the point that saying it now seems like a waste of our time and a cliche. But honestly, we can't, if there's nothing new to be said, then I won't say it. This is true that if we don't fix these fundamental things, then we are going to be at risk of getting diseases. And once we get diseases, you need intervention, you may need medicines, you may need et cetera, et cetera. So I think one important takeaway and a reminder, by the way, I always preach to myself above all, because it's never easy to do. But I'm going to say it even though everyone knows it. 7 to 9 hours of sleep, good quality sleep, eating a healthy, balanced nutrition, exercise 3 to 5 times a week, have good relationships, at least a few things that are beyond transactional, and then some meaning and purpose and connection, perhaps with a higher power or with the universe. Do you see that as, in the work that you're doing from the Institute, it sounds like a lot of these, you're looking at some of these practices in terms of yoga, meditation, and nutrition as well?
Absolutely. I think to the list that you've said, I would add good breathing and a calm state of mind. In the
Yeah,
time we've
absolutely.
been talking, in the time that since this panel started, I'm looking at the clock here, 21 people have committed suicide somewhere in the world. And one more is going to do it in the next 30 seconds. Nobody gets up in the morning and is like, oh, today is the day, I'm going to end it. It starts with lack of sleep, isolation, segregation, sadness, conflict, anger, inability to handle emotions. Neither in school nor in college or in university have we been taught how to handle our emotions. We don't know what to do when anger comes up. We don't know how to break it down. We don't know what to do when road rage hits us, or when our child is annoying, or when our wife wants to get takeout, when all you want to do is children, young kids, they're all just, I'm old enough to say young kids, joining the IIMs, locking them up in their rooms, doom scrolling all the time, not able to connect with people. I think this is something we really, really need to take note of and build into the equation, which is why the sensitivity quotient or spiritual quotient, you can call it, which is human values, a sense of self, a sense of who we are, being okay with who we are, I think is kind of really, really important. And I don't know if you know this, but stress, 70% of the stress in the body can be exhaled through the breath. So there are techniques available. I remember when I did the first Art of Living course, I remember thinking, surely it can't be this easy. No, I've been so stressed and angry and irritated and all sorts of things and achieving at the same time. But surely 15, 20 minutes cannot make such a difference. It can. And 800 million people worldwide in 180 countries testify to that.
No, I certainly think, breathing is, of course, we know that it's the only autonomic function that is both under voluntary and involuntary control. So it's part of, generated by the same parts of the brain that are to do with emotion, and so it offers an opportunity to modulate the unconscious parts of the brain. I just want to say, though, one of my interests is integration, as you know, which is integrating insights from Vedanta, yoga, meditation with Western science and therapy. And the reason I talk about integration is that while, breathing and yoga are transformative, at the same time, I don't want anyone in the audience to believe that that necessarily can treat that. There are many instances where breath may help you a little bit, but there may be deeper trauma, more difficult issues that certainly need to be explored from Western psychotherapy. It might need medicines. So the integration does not mean disavowal of any one system of intervention or medicine. It's understanding the synergies between the two. Because I know a great many people on both sides of the equation. If leaning on only one side of the equation, you may not get the results you want. For example, if person A says, I have a mental health issue, I'm only taking the medicine, but not looking at lifestyle, breath, meditation, relationships, so on and so forth, that usually does not result in the best results. And we know that from data. On the other hand, I think many, many places places where yoga is going on are replete with people who are still emotionally suffering. And they're continuing to suffer, but belief is that that system is the only way to achieve mental health. And that's also something that we want to prevent, So integration, in my view, is really, really important so that nobody gets left out, between the two. Dr. Mala, what are your thoughts?
Yeah, I think going with what Mrs. Sumati pointed out, and again, the integration that you're talking about, Dr. Shyam. Again, what I am seeing and what I would also want to add is going with what Sumati also talked about, the emotional skills. Many of the times, as she pointed out, what do we learn in schools? What do we learn at home? Where do we learn emotional skills? And when I do parenting workshops or workshops for parents in schools, for children, for adolescents, this is what we kind of point out to parents and caretakers, that we need to help them understand what emotions are and how to deal with emotions. Because when we are talking about entrepreneurship and mental health now, how is it connected to entrepreneurship? Why are we talking about all these things when we are sitting with the whole lot of entrepreneurs here? Because as entrepreneurs, what we typically do, like anybody in our hustle bustle life, we do not focus on our emotions. We do not know when we are feeling what emotion. We only feel that I'm tired, I'm stressed. These are all very common layman jargon, the stress, I'm stressed. What does stress mean to each person? So here, what I would also want to add is, what is it that I am as an individual, and where do I look at myself 10 years down the lane, 5 years down the lane? I should be able to identify my vision, my motivation, what I think of myself. And again, when we talked of fear and fear of failure and not able to integrate into self, that flexibility, that adaptability, that able to have that resilience, and what we also point out when we talk to our clients and when people come to therapy, when they take help, is that sense of self-worth. And that self-worth is a very important component of who we are. And very often we use the term confidence. Oh, you should have confidence. What is that confidence? Confidence is nothing but how I look at myself. And where do you look at yourself? From the aspect of self-worth. Where is self-worth derived? We don't get it from the next shop. Self-worth is what we need to understand, and through our experiences, through our past, and through our learning, we need to make it a part of our strength, which helps us or cushions us towards whatever we face, challenges, demands, or failures. We are able to take it as a part of our learning experience. Recently, I was going through a research, a bunch of researchers from University of California have done this research where they say that around mental health and entrepreneurship, they say 49% of entrepreneurs go through mental health breakdowns. 49%. And they have pointed out one major mental health condition they would carry. It could be ADHD, it could be depression, it could be anxiety, it could be an onset of psychosis. So this is how critical it is, and many of the times, again, as I told, when people come to therapy, they only come with elevated symptoms. They do not come as a part of understanding, okay, there are certain things I'm going through a few weeks or months. Years they would have overlooked it. They would have pushed themselves to the edge, and then they come to therapy because that is when they feel helpless and lost. So the feeling of helplessness, worthlessness, feeling lost is something that drives them to take help. And that is where it takes obviously therapy or any kind of mental health work is not something like, giving a 5-day prescription saying that, okay, take this for 5 days and then, you come back to us and you'll be fine. It's a long work. It takes a long time, long period. It's long term. So this is where, rather than cure, we look at prevention. To be aware, to be able to understand what I am with, what I am into, and then take the right steps to deal with whatever challenges you face.
Thank you. Thank you, Dr. Madhav. Yes, while we've been talking about stress management, we have all been slightly stressed by the clock,
Yeah, the clock
and the pressure of time. But so with some closing remarks, briefly, anything you'd like to share?
As entrepreneurs, we are responsible for ourselves, but we're also employing a lot of people. And they say when you want to help someone or give someone a hand, you have to be on firm ground. So I think my message is, let's be strong entrepreneurs and take care of our teams and their families. The days of giving bonuses for motivation are over. Now we have to take care of the people across our supply chain as well. So over to you on that.
I think one thing I would want to say all the entrepreneurs is, let go of perfectionism. There's no perfect place. Be okay to just be okay. It's okay not to be okay. I think I tell this to all my clients. So perfectionism looks like a fantasy place, but it's very scary there. So just drop it. Be there. That's more than enough.
No, I completely agree. I think there's a profound wisdom that you can find all over, both on Instagram and outside. I mean, the truth has been said in so many forms. We just have to absorb it. And to me, one of the problems of Western therapy in general, only using that construct, has been, in my view, over time, it results in hyper self-focus, self-absorption, extreme rigidity, boundaries, isolation, and fragility. I'm interested in integrating the insights from Western therapy with perennial insights from the East. One of the greatest differences in the Eastern and Western philosophies and ideas of happiness was in the East, they always told us that happiness will come when you transcend and dissolve your ego, yourself. And beyond the self is where true happiness lies. In the West, all of therapy is predicated on the idea that I'll make you a stronger, more separate individual so you can describe yourself eloquently and tell everybody exactly who you are and what your boundaries are. But that ultimately, in my view, will not lead to lasting happiness or good relationships. And therefore, as we navigate this journey, whether it's entrepreneurship or just life, I think it's important, like you said, like we all said, that you immerse yourself in the work, in the doing, but also have this transcendent perspective where you know that you are okay no matter what. That all that, those attachments that causes pain, we enjoy them, but we also know that somewhere we exist even beyond. And I think having those two perspectives and experiences of the self will liberate us on this path. Thank you so much. You've been a great audience, and thank you to the panelists. Thank you.